working with the cystic fibrosis patients, their mental health was monitored very closely because cystic fibrosis was essentially a death sentence at that time. Now therapy is great. Right now, it's not a death sentence, but back then it was. So their mental health was monitored carefully. And there was never any reports of individuals with CF having autism. And CF is associated with tremendous amount of oxidative stress at the mucosal surface. But it's the opposite inside their body. In fact, it's been documented they are super metabolizers of acetaminophen. I mentioned earlier, if you lined up 1 million people, you would get pregnant women and people with cystic fibrosis are the best, and then newborn babies and kids with autism are the worst. So
I think it's important to note that cystic fibrosis is congenital. You're born with it.
That's correct.
So that's important. If that's something that you develop later on, because that would change the whole equation here.
Yeah,
so,
you're already it's the biochemistry for acetaminophen metabolism is already hardwired in very, very early because your body's trying to compensate for all this oxidative stress of the mucosal surface. That's how the model works there.